Brachioplasty is the term given for the operation which reduces the excess amount of skin on the arms. It's commonly referred to as bingo wings. This is generally an excess of skin, which means that when someone holds their arm up, there's a sagging or drooping of skin between the elbow and the armpit that hangs low and is a bit wobbly. The operation to correct it is, firstly, it's important to assess appropriately and plan appropriately and remove the excess skin. And it's done on the inside of the arm. So in this section here, it leaves us with a scar, which is a single line, which generally travels from around about the elbow to around about the armpit. And it takes away that excess skin. What's very important to recognize is that we don't make things too tight. This can lead to swelling in the hand or the forearm, and that we take away sufficient tissue, but we will leave a little bit of laxity. It's important to have what could be described, I suppose, as bending skin. Brachioplasty is something which is commonly associated with massive weight loss patients. So people who have lost a significant amount of weight, that their weight has stretched the skin, but when you lose that weight, the skin remains stretched. It won't shrink by itself. And so the ideal candidate for brachioplasty is someone who, firstly, has that skin excess, secondly, has general health, and so general health and well-being. They are likely to heal well after surgery, but also that their weight is stable. If someone has skin excess and they've reduced their amount of weight and they're still reducing their amount of weight, it probably makes sense to wait until their weight is stable in order to then perform surgery. Otherwise, we could be reducing that excess and then they lose more weight and generate yet further excess. So being stable in weight is, I think, an ideal time for it. But as long as there are no contraindications to healing or surgery, then that would be the ideal candidate. Any operation has the potential for pitfalls and complications, and these range from general things such as blood clots in the legs or in the arms, infections or wound breakdowns. Scars can be a little bit more prominent in this sort of surgery, and important to assess and plan, because if we resect too much and leave things too tight, then not only can we increase the risk of wound breakdown, but we can also get swelling of the hand and the arm. There are very rare complications associated with damaging nerves or blood vessels as well, but the surgeon should discuss this with you at length when planning surgery. Brachioplasty is the reduction of skin excess, and anybody who has a significant amount of skin excess will find that it does compromise a lot of activities, and particularly sporting activities such as golf or tennis, things that involve swinging and moving the arms. Not only is it socially uncomfortable and unhappy for patients to be doing this sort of thing, and indeed they may avoid activities in order to not have that problem, but reduction of the skin excess will allow a lot more flexibility, but principally it's about confidence. The recovery time from brachioplasty surgery is a little variable, but broadly speaking, returning to most normal activities by around about 4 to 6 weeks, and I would anticipate being back to absolute normal from 3 months and on. Brachioplasty surgery is extremely well received. When planned and executed properly, it has a very low complication rate and highly successful and long-term outcome. So in the appropriate candidate who is prepared and ready for surgery, it is an excellent operation.